What if everything you've been told about aging and intimacy is missing something? What if the silence, the kind that creeps in slowly as we grow older, is actually the most dangerous part of all? You see, I've sat with hundreds of patients, many of them in their 60s, 70s, and beyond. They come in for the usual reasons: blood pressure, sleep issues, maybe a little back pain or trouble with their bladder. But very few walk in and say what's truly weighing on them. Most don't even realize what they've lost, only that something has gone quiet inside. A kind of stillness that doesn't feel like peace, more like absence. And often, when we begin to peel back the layers, we find the same story beneath. I haven't touched myself in years. I thought it didn't matter anymore. I want to talk about that story because what you've been told, or maybe what you haven't been told, about pleasure, self-touch, and sexual health in older age matters more than you think. Let me tell you about John. He's not a real patient, but he could be. A retired electrician, 68 years old, soft-spoken, kind. He came to see me for fatigue and a general sense of disconnection. His wife had passed 5 years earlier. "I just feel flat," he said, "like my body doesn't belong to me anymore." He'd gained some weight, his joints hurt more than usual, and he wasn't sleeping through the night. On the surface, it sounded like aging doing what aging does. But something about his tone, the hesitation in his voice, the way he avoided eye contact when we talked about daily routines, made me pause. So I asked him gently if he ever experienced desire anymore, not necessarily with someone else, just in his own body. He looked down at his hands, then gave me a small shrug. "That part of me is gone," he said. "I haven't done that in a long time. Feels like something I left behind." That moment broke something open, for both of us, because what John said so quietly is something I've heard echoed in different ways by countless people. They stop masturbating. They stop touching themselves. They stop thinking of themselves as beings worthy of sensuality, of connection, of softness. And over time, that silence becomes a form of loss they don't even have words for. Now, I'm not here to tell you that you must do anything with your body that doesn't feel right. But I am here to tell you this. When we stop stimulating ourselves, not just sexually, but sensually, emotionally, we begin to lose a vital thread of connection to who we are. Because the truth is, our bodies were never meant to be silent. They were made to hum, to pulse, to respond. Even at 80, even at 90, that part of you doesn't have an expiration date. And biologically, there's a lot going on beneath the surface. When you masturbate, when you stimulate your body in a way that brings pleasure, you're not just chasing a feeling. You're creating a cascade of physiological events that support nearly every system in your body. Think about it. During arousal, your blood flow increases, particularly in the pelvic region, which is often one of the first areas to suffer when movement and circulation decrease with age. That blood flow nourishes tissue, oxygenates cells, and helps maintain muscle tone in parts of the body that you might not otherwise be using regularly. For men, regular ejaculation can help prevent fluid buildup in the prostate and may even reduce inflammation risks. For women, stimulation maintains elasticity in vaginal tissues, supports lubrication, and keeps nerve endings engaged. These are not small things. They're essential to comfort, confidence, and health. Then there's the hormonal symphony that plays when you experience pleasure. Masturbation triggers the release of dopamine, your motivation hormone. It elevates mood, increases alertness, and creates a sense of reward. Oxytocin follows, the bonding hormone, often called the cuddle chemical. It lowers cortisol, your stress hormone, and promotes feelings of connection, even when you're alone. That release can help you sleep better, lower your blood pressure, and ease symptoms of anxiety and depression. And yes, these effects still happen even in your later years. What's more, when you engage in self-pleasure, you reinforce a neurological pathway that says, "I am here. I can feel. I am still connected to this body. And that message, quiet though it may be, can make all the difference in how you move through your days. It can influence how you walk, how you eat, how you relate to others. It anchors you back into yourself. But there's something else that happens when people stop touching themselves. Something quieter, but deeper. They begin to forget what it feels like to inhabit their body with affection. I've seen it so many times, the slumped posture, the self-deprecating jokes, the way their hands flutter nervously over their midsection or thighs, as if those parts don't deserve kindness anymore. There's a grief there, a kind of mourning for a body they think they've lost. Not because it stopped working, but because they've stopped believing it still matters. And so many of them ask, in whispers, in hesitant glances, is it okay that I still want this, that I still think about touch? And my answer is always the same, yes, not just okay, necessary. Society, unfortunately, tells us that desire belongs to the young, that once your hair grays or your skin loosens, you're supposed to trade in pleasure for practicality, that if you still want to touch yourself or be touched, you're somehow clinging to something undignified. But that narrative, it's not only wrong, it's harmful. It silences people, it shames them, and it robs them of one of the most powerful sources of self-connection available to us. Because here's the truth that no one puts on billboards or in glossy magazines. Sexual vitality is not about youth. It's about aliveness, about staying connected to sensation, curiosity, and the rhythms of your body. That doesn't go away just because your body changes. If anything, your capacity for rich, nuanced, deeply personal pleasure can grow deeper with age, if you let it. But I also know that starting again, especially after years of disconnect, can feel intimidating. For some, the thought of touching themselves brings up old shame or awkwardness. For others, the desire is there, but the body doesn't respond the way it used to, and that creates grief. These are real feelings, and they deserve tenderness, not judgment. So when I talk about masturbation, I'm not talking about performance. I'm not talking about reaching a goal or doing something perfectly. I'm talking about something quieter, more essential, a gesture of care, a way to say to yourself, I still want to feel close to this body. I still want to know it. I still want to offer it kindness. And that kindness can start small. It doesn't need to be a sexual act at first. It can be running warm water over your skin and noticing how it feels. It can be letting your fingers rest on your belly, not with critique, but with curiosity. It can be putting lotion on slowly, not just to hydrate, but to reconnect. These small touches are not meaningless. They're invitations to feel, to remember, to return. Sometimes I'll suggest my patients begin not with touch at all, but with breath, just sitting quietly and breathing into the lower belly, feeling the rise and fall, the gentle movement of the pelvis, the warmth that starts to build. This is how we begin to thaw the parts of ourselves that have gone cold from disuse or neglect, not through force, through presence. And presence, more than anything, is what your body craves. Not just activity, but attention. Not just function, but affection. Because you are not just a collection of systems. You are not just a body that needs managing. You are a living, breathing, sensing human being. And your desire to feel pleasure, to experience intimacy with yourself, is not only normal, it's vital. We often speak about health in terms of numbers, cholesterol levels, blood pressure, BMI, but rarely do we talk about the emotional texture of health, the way it feels to live inside your skin, whether or not you feel connected to it, whether or not it feels like home. And for many older adults, the answer is quietly, heartbreakingly, no. But it doesn't have to stay that way. Even if it's been months, years, even decades since you last touched yourself, it's not too late. Your body remembers. Your nervous system remembers. It may take time, gentleness, and patience, but the door isn't closed. The path is still there, waiting for you to walk it again, at your own pace. Because this isn't about youth, it's about dignity, It's about honoring the lifelong capacity your body holds for sensation, for softness, for connection. And as we move forward, I'll show you not only why this matters, but how to return, step by step, to a deeper relationship with your body, one that feels alive, even now. Let's keep going. So let's begin with something simple, a question. When was the last time you touched your body? Not to fix it, not to critique it, not to push it through another task, but to care for it, to honor it? Not for someone else, not out of duty or routine, but just because it's yours? There is something profoundly healing in that kind of attention, in the slowness of it, in the willingness to approach your own body with curiosity instead of judgment. That's the space I want to invite you into, because pleasure, real, nourishing, grounding pleasure, doesn't begin with the act. It begins with permission to come home to yourself. You don't need expensive tools or a specific technique or even perfect mobility. You only need one thing, a willingness to feel again. That might look like a 5-minute moment in the morning where you place your hand on your chest and breathe. It might look like sitting in a sunlit room, letting the warmth settle over your shoulders and thighs, remembering that this skin is still yours, still alive, still capable of responding. And if the thought of touching yourself in a more intimate way feels too far right now, that's okay. This isn't a race. It's not a performance. It's a return, and return can be slow. In fact, it's better that way. Many of the people I work with are surprised to learn that masturbation, when approached intentionally, can help regulate not only emotional well-being, but physical systems that often struggle with age. Think of pelvic floor strength, for instance, the same muscles that support bladder control, sexual function, and even core stability. Those muscles weaken not just from age, but from disuse. Gentle stimulation, solo or partnered, helps keep them active, aware, responsive. It's like watering a plant you forgot was there, and over time, that subtle attention brings it back to life. I often tell my patients, your body doesn't stop wanting attention. It only stops asking loudly. That means we have to learn to listen in a different way, not for dramatic signals, but for the quiet ones. The way your lower back softens when you breathe deeply. The slight warmth that returns when you allow yourself even a few minutes of self-soothing touch. These are small things, yes, but they're not insignificant. They're seeds. And given time, they grow. And let's not forget, this kind of connection isn't just physical, it's emotional, psychological. Sexuality isn't separate from your mental health. It's deeply woven into how you see yourself, how you experience your place in the world. When that part of you goes dormant, it changes how you walk through life. It creates a subtle layer of grief, often unnamed, often unacknowledged, that feels like disconnection, like fog, like something vital has been misplaced. When you begin to reconnect with your body in this way, that fog begins to lift. Slowly, yes. Gently, but unmistakably. People often tell me, I don't feel like myself anymore. And they're not just talking about aging, they're talking about loss of intimacy, not just with others, but with themselves. When you stop engaging with your own body, you stop receiving information from it. You lose access to joy signals, to comfort, to the self-reinforcing loop of feeling good because you gave yourself something good. And that absence can ripple into everything. Relationships, appetite, sleep, movement, memory. So much of what we call aging is, in fact, disconnection. But it doesn't have to stay that way. And if you're still unsure, still hesitant, I want you to know that's okay. You don't need to go from silence to sensation overnight. There's no right way to reintroduce pleasure. For some people, it starts with reclaiming their reflection, looking in the mirror not with criticism, but with curiosity. For others, it starts in the body, but through non-sexual pathways, a hot bath, a soft blanket, a favorite scent rubbed gently into the neck or wrists. These are not frivolous things. They're bridges, and every bridge matters. I once worked with a woman in her late 70s, a widow who hadn't touched herself in decades. She was raised in a time where that kind of exploration was considered shameful. Even after her husband passed, she never allowed herself the space to rediscover that part of herself. She told me quietly, "I thought desire was something I gave away. I didn't know I could keep some of it for me." And slowly, tentatively, she began to explore. Not just sexually, but sensually. She started sleeping with soft fabrics. She began dancing a little in her kitchen when she made tea. One day she came in and told me, through tears and laughter, "I touched myself last week, not out of boredom or sadness, just because I wanted to feel warm again." That warmth, that spark, is not something reserved for the young. It's not a luxury. It's a birthright. And it never leaves you. It waits, it softens, it quiets, but it does not disappear. Which is why I believe so strongly in these small, consistent rituals. 5 minutes of attention, 10 minutes of care, a willingness to be with your body, not to fix it, but to learn it again, like a language you once spoke fluently and are now remembering, word by word. And please, don't let perfection be the enemy of presence. You don't need full mobility, you don't need flawless skin or a partner or a plan, you just need breath, willingness, and perhaps the smallest sense of longing that pull toward being a little more alive in your own skin. If you're someone who lives with a disability or chronic pain or trauma around touch, know that you are not excluded from this conversation. Your body, in whatever state it's in, is worthy of tenderness. Your pleasure, whatever form it takes, is just as valid. There is no template. There is no right. There is only you, your story, your rhythm, your desire. And what you desire may not be climax. It may be comfort. It may be ease. It may be the simple relief of knowing that you can bring warmth into your body without needing anyone else to make it happen. That autonomy, that agency, is powerful. It builds self-trust. It lowers fear. It reminds you that your body is not just something happening to you. It is something you can engage with, care for, and enjoy. That's the heart of this message. Not just that masturbation is healthy, though it is. Not just that it supports your circulation, your hormones, your sleep, though it absolutely does. But that it is a practice of remembering. Remembering that you are here, that you are still capable of joy, that even now, especially now, you can be a source of warmth to yourself. And when that begins to take root, other parts of life shift too. I've seen people reclaim their appetite, move their bodies more, speak with more certainty, laugh more deeply, all from that one small change, deciding to make space for sensation again. Because we are not just surviving machines, we are sensing, longing, breathing creatures. And when we allow ourselves to feel fully, not just pain, but pleasure, we step into our full humanity. So wherever you are right now, I want you to pause. Place a hand, gently, on your body, maybe your chest, or your belly, or your thigh. Breathe into that space. Notice what it feels like to simply be with yourself without expectation. That's the beginning. That's the return. And if something stirs, a memory, a desire, a sadness, a spark, let it come. That too is part of the process. This is not just about stimulation. This is about repair, about reclamation, about telling the truth of your body, even when no one else is listening. You deserve to feel alive. You deserve to feel connected, not because you're trying to reverse age, but because you're honoring life, the one still pulsing in you, the one still asking to be seen, felt, held. So take a step, a soft one. Maybe today it's a breath, maybe tomorrow it's a gentle caress, maybe next week it's more. Whatever it is, let it be yours, and when you're ready, when you found even a sliver of that spark again, hold on to it. Not tightly, just enough to remember that it never left. It was waiting for you. Thank you for letting me share this with you. If any part of this touched something inside you, you're not alone. I hope you'll leave a comment or simply carry this message with you through the rest of your day. Because this journey, the one back to your own body, is one of the most powerful you'll ever take. and you don't have to rush. You just have to begin.